It's Health Tuesdays here on your Feel Good Breakfast Show, and we're all about talking about endometriosis, which is a common and sometimes very painful condition which can affect up to 1 in 10 women. Now, endometriosis can cause a wide range of debilitating symptoms such as pelvic, abdominal and back pain, heavy and painful periods, as well as infertility, and in some cases, no symptoms at all. Now, here to discuss the topic of endometriosis, we welcome back gynecologist and obstetrician Dr. Jason Bennett. So good to have you with us this morning.
Thanks, Jamie Lee. Good to be here.
What exactly is endometriosis?
So endometriosis is a medical condition where the special cells that are normally located inside the womb or the uterus are actually sitting outside of the uterus, and they can attach to certain organs like the ovaries, the bowel or the bladder. And during a woman's cycle, this can cause a very painful and destructive reaction.
Is this something that we as women can prevent? And maybe what is the cause when it comes to this?
So what is the cause of endometriosis is a good question, and not everyone really knows, and we're still trying to work it out. But there are a few theories, and one of the most popular theories is that instead of the menstrual blood or the period flowing out, it flows backwards through the tubes, and it can sit in places where it shouldn't, just like the ovaries or bowel or bladder.
Again, I'm loving that we're opening this conversation because a lot of females go through this and don't actually know that this is what's happening to them because, like I mentioned, we get pelvic pain, back pain, which can sometimes be linked to our menstrual periods. But what are some of the common symptoms when it comes to endometriosis?
So the main symptom is pain, and this pain can happen just before your period, during your period, after your period, or it may continue throughout the entire month. The pain is normally located in the lower part of your tummy or your abdomen, and it can move to your back and even to your inner thighs as well. Some other symptoms that people experience is pain during sex. Some people may have bloating, diarrhea, constipation. There also may be some pain when women pass urine or when women have a bowel movement.
I did mention that sometimes you don't have any symptoms at all. So how do you then figure that out?
A lot of women don't actually know that they have endometriosis, and a lot of women find out that they actually do have endometriosis when they battle to fall pregnant, because endometriosis can cause infertility or inability to get pregnant.
Let's talk about the other complications within the body if you do have endometriosis.
So endometriosis can be quite destructive. So what it can do inside the body, then like you get a scar on your skin, a similar type of thing can happen, but inside a woman's body. And these type of scarring can cause damage to the tubes. It can damage your ovaries, your bladder, and your bowel. And it can cause infertility by damaging the tubes.
That is some hard facts right there, but of course our viewers, there's women watching right now and thinking that they might have this. Is there a treatment? What can we do if you think that you have endometriosis?
So there is a treatment. It's not something that's easy to treat, but there are a few things that we can do. Number one, we must control your pain, okay? So normal analgesia. Number two, the mainstay of treatment is to try and decrease or stop your periods. And we do that by starting the birth control pill. We can use something called progesterones, something like the 3-month injection or the 2-month injection. In quite severe cases, we actually put a woman into early menopause when endometriosis is really bad. Next step is surgery, and we use something called keyhole surgery, and we actually remove the endometriosis that's inside parts of the body where it shouldn't be. Next step for people who have problems falling pregnant, obviously we have to use surgery, but then at some point we do have to consider in vitro fertilization.
Well, I'm glad that we spoke about this because, again, there is help for those women out there that are suffering. So, Dr. Jason, thank you so much for joining us this morning. Now, of course, for you at home, as the pain of endometriosis can more than often be quite debilitating, BRUFEN is there to help aid in pain relief and with inflammation, making the condition more manageable, especially during that time of the month.
Targets pain caused by menstrual cramps. BRUFEN works where it hurts.